Should your hard-earned tax dollars pay for healthcare for illegal immigrants while millions of Americans are struggling to afford a simple doctor's visit? That's the question that lit up the room yesterday during a White House press briefing when Press Secretary Karoline Leavitt took on a reporter and asked point blank, "Do you think illegal aliens should receive Medicaid benefits?" Her tone was sharp, her words deliberate, and the message unmistakable. Taxpayer money should serve Americans first. This exchange instantly went viral because it touched a nerve many citizens have been feeling for years. Why are we footing the bill for non-citizens while we can barely afford care ourselves? Before we dive into the politics, let's ground this conversation in reality. Healthcare costs in America are at record highs. The average deductible for an individual health plan exceeds $1,700, while total family premiums average over $24,000 per year, according to Kaiser Family Foundation, KFF, data. At the same time, federal and state governments are spending close to $870 billion annually on Medicaid, a lifeline program designed to help low-income Americans, not people living here illegally. When citizens are choosing between groceries and medicine, it's no wonder this issue strikes a deep emotional chord. Karoline Leavitt didn't hold back. She accused the Biden administration of paroling tens of millions of illegal aliens into the system and giving them access to free benefits. She argued that this policy is unfair, that it burdens working families already suffering from inflation, and that it worsens hospital wait times for everyone else. Whether you agree with her politics or not, her remarks captured frustration across the political spectrum. The feeling that Washington is writing blank checks with taxpayer dollars while ignoring the needs of its own citizens. This press briefing wasn't just about immigration, it was about accountability. Americans want to know where their tax money is going. When officials claim to protect the most vulnerable, yet appear to prioritize non-citizens, the public loses faith. That erosion of trust is dangerous because it weakens support for vital safety net programs like Medicaid and Social Security. And once faith in those systems breaks down, rebuilding it becomes nearly impossible. Now let's talk about facts, not talking points. Under current federal law, undocumented immigrants are not eligible for full Medicaid benefits. That's black and white under the Social Security Act and subsequent reforms. Only qualified immigrants, such as refugees, asylees, or lawful permanent residents, can access Medicaid, and even then, most must wait 5 years after receiving legal status before qualifying. So, the idea that tens of millions of illegal aliens are instantly getting free, comprehensive Medicaid is simply not supported by the law. However, there's an exception called Emergency Medicaid, required under the Emergency Medical Treatment and Labor Act. This rule says hospitals must provide life-saving emergency care to anyone in need, regardless of immigration status. That means undocumented individuals can receive treatment if they show up to the ER with a critical condition, but it covers only the emergency, not ongoing care, medications, or preventive visits. It's a necessary humanitarian safeguard, but critics argue that states sometimes stretch its limits to cover more than intended. Medicaid now serves about 85 million people nationwide, nearly 1 in 4 Americans, at an annual cost of roughly $870 billion in 2023, according to federal budget data. Of that, less than 1% goes toward emergency services for undocumented immigrants. In other words, while the total spending number sounds enormous, the share used for non-citizens is relatively tiny. Still, for many taxpayers, even 1% feels too high when millions of citizens can't afford dental visits or basic medications. Let's take real-world examples. In New York, emergency Medicaid enrollment for undocumented immigrants surged to 480,000 people in 2024, up from around 250,000 just 2 years earlier. The cost? An estimated $3 billion per year. And that's just one state. In California, lawmakers approved a plan that could spend over $6.4 billion annually to expand coverage for undocumented residents, partly funded through state and federal dollars. Those programs blur the line between emergency only and full benefits, sparking intense debate over where federal responsibility ends and state experimentation begins. A viewer summed it up perfectly. I can't afford to see a family doctor. I have insurance, but the bills are horrid. That one sentence says everything. Across the country, millions of Americans, seniors, veterans, single parents, are rationing medicine, skipping checkups, and living with untreated pain because costs are out of control. These are the very people Medicaid was built to protect, and yet they feel sidelined as headlines scream about taxpayer-funded benefits for illegal immigrants. Let's not ignore the human side of this. In border hospitals across Texas and Arizona, emergency rooms are overwhelmed, with local governments forced to absorb millions in uncompensated care. Doctors there report treating migrants who cross in medical distress, while funding for rural health clinics dries up. It's not that compassion is wrong, it's that the financial burden is falling unevenly, leaving American communities struggling to stay afloat. That's the core tension this debate exposes. Let's be honest, fairness is at the heart of this. Every paycheck you earn has deductions for Medicare, Medicaid, and Social Security. That's your money. You've earned it by following the law, working hard, and paying taxes. It's not unreasonable to expect that those funds should benefit citizens first. America's social safety net was designed as a promise to its people, to the workers who built this country, not as an open invitation to anyone who arrives here illegally. Beyond morality, there's a matter of sustainability. The Congressional Budget Office warns that Medicaid spending is projected to surpass $1.1 trillion annually by 2030, driven by aging populations and higher medical costs. If even a small percentage of those funds are misdirected, it compounds budget deficits and risks future cuts for legitimate beneficiaries. In short, prioritizing citizens isn't xenophobia, it's fiscal responsibility. Critics often say, but immigrants pay taxes too. That's partly true. Many undocumented immigrants contribute through payroll deductions using individual taxpayer identification numbers, ITINs, or fake Social Security numbers. The IRS estimates they collectively pay about $12 billion annually in various taxes. However, contributing doesn't automatically grant access to federally restricted programs. The U.S. has always drawn lines between contributors and beneficiaries based on legal status. It's the backbone of how entitlements work. Another argument is healthcare is a human right. Morally, yes, no one should die from a preventable illness, but practically, resources are finite. The federal budget must prioritize citizens first, just as every country does. Even in Europe's universal health systems, benefits for non-residents are limited. Compassion must be balanced with control. Without boundaries, public programs collapse under their own weight, and then nobody gets the care they need. If policymakers truly care about fixing this issue, it starts with enforcement and transparency. The Centers for Medicare and Medicaid Services, CMS, recently pledged to increase audits on states that misuse federal funds for ineligible immigrants. That's a good start, but oversight must go further, with penalties for states that repeatedly stretch definitions of emergency care. Congress should also clarify gray areas in the Emergency Medical Treatment and Labor Act to prevent abuse while ensuring hospitals can still respond to genuine life-threatening cases. At the same time, we can strengthen care for Americans in need. Expanding affordable primary care, lowering prescription costs, and improving access for low-income seniors would go much further towards solving the real crisis, citizens being priced out of their own healthcare system. Reforming Medicaid doesn't mean cutting it. It means making sure it serves the right people, in the right way, for the right reasons. This isn't about hatred or division. It's about principle. America cannot help the world if it cannot help itself first. Taxpayer programs must prioritize citizens, or they lose legitimacy entirely. When hardworking Americans see their own children uninsured while non-citizens receive state-funded care, it breeds resentment that fractures our unity. Compassion starts at home, with veterans, single parents, disabled workers, and seniors who earn these benefits through decades of contribution. If government leaders want to restore trust, they must draw a clear line. Emergency aid in crises is humane. Open-ended benefits for those here illegally are not. Protecting taxpayer dollars is not cruelty, it's stewardship. It ensures that the promises made to citizens are promises kept, and that Medicaid remains a safety net, not a global subsidy. So, what do you think? Should illegal immigrants have access to taxpayer-funded Medicaid, or should that money be reserved for Americans who've earned and paid into the system? Leave your thoughts below. Let's get this debate trending, because if taxpayers stay silent, nothing changes. If you found this analysis helpful, hit that like button, subscribe to Social Security Post, and share this video with someone who cares about how their tax dollars are spent. Together, we can hold policymakers accountable, protect our benefits, and make sure fairness comes first again.